Hello, I'm Nick the nurse. Today we're going to be talking about the concept of systematic desensitization as it relates to patients who have phobias. Now, I think, first of all, it's important to establish what a phobia is. A phobia is an irrational belief. It's a belief, for example, that a patient has arachnophobia, which is a fear of spiders. But what really makes them fearful of spiders? Maybe they saw a spider earlier in life. What's important to understand is that the patient has no rational, real belief for having a fear of spiders. Most spiders actually aren't even poisonous or not venomous. They don't hurt you. So the belief is not rational. One of the things that we deal with when or use during the therapeutic nurse relationship during the working phase is systematic desensitization. Now, systematic desensitization is where you gradually introduce the patient to the stimuli that is causing their phobia. The example that I like to use when I'm teaching my nursing classes is that when you have a patient who is afraid of heights. You know, if a patient is afraid of heights, you don't lead them by the hand to the top of the Empire State Building, right? Why? They're probably going to get all anxious. What you want to do is systematically, through systematic desensitization, desensitize the patient by gradually introducing the stimulus. For example, this is the example I always use. If a patient has a fear of heights, what you want to do is have them go maybe to a step ladder and have them go up one step per day. For example, on the first day, you might have them go up one step. And the second day, 2 steps, and so forth and so on, until the patient can actually at some point get to the very tippity top of the ladder. You don't introduce everything at once because this is going to overwhelm the patient. In mental health nursing, if we overwhelm our patients, they're not going to trust us, and it's going to impede process. So systematic desensitization is an important concept that's introduced by the nurse during the working phase of the therapeutic nurse relationship with the client or the patient. I don't like the word client, with the patient, in order to help them get over their phobia. This is something that you want to understand for your nursing school exams, for the NCLEX, and in your nursing practice. Thank you for joining me, and we'll talk to you soon.